In this video, we'll be reviewing fluid volume deficit by going through 5 different questions and critically thinking. For those listening, I will read the question, then I'll pause to give you a chance to access all that great information in your brains. Then we will read the options and discuss. This is just a surfaced overview. If you need more information on this topic, please refer back to your nursing resources under the fluid and electrolyte chapter. Let's get started. Question number 1. A patient suffered second-degree burns over 30% of his body 3 days ago. The nurse knows that the best way to assess fluid balance is to... Is it to, number 1, calculate the INO, which is intake and output balance. Number 2, check the blood pressure every 4 hours. Number 3, monitor urine output. Or number 4, weigh the client daily. The answer here is number 4. So breaking this question down, we know burns causes fluid deficit and third spacing, and we want to make sure to assess his fluid balance now. And so the thought is that the best way is daily weights. So the answer was number 4. Further learning, if you need to review that daily weight is used for fluid balance versus INO calculations are used to determine more so if interventions are working like diuretics, replacement fluids, not necessarily as an overall determination of fluid balance. Question number 2. A nurse caring for a child who is 20 months old is assessing for dehydration. Which of the following assessments would the nurse perform? Select all that apply. Is the answer number 1, to assess for sunken fontanelles? Number 2, ask how many wet diapers the child has. Number 3, ask if the child has been sleepy. And or number 4, ask if the child has been complaining of dizziness. The answers here are number 2 and 3. Let's break down this question. This is a 20-month-old. Remember, if tests give you numbers, pay attention. That might change your answers. The nurse is assessing for dehydration. So we're thinking things like decreased level of consciousness, lack of tears, saliva, decreased urine output. Be careful, the fontanelles cannot be assessed here. The child is too old. Therefore, doing the true-false method, which is best for select all, number 1 is false. Number 2 and 3 was true. And number 4 is false. This is a child who is 20 months old. They wouldn't have the language to complain of dizziness, so be careful with those answers in pediatrics. The best way to assess pediatric patients is objective signs. So if you need to review the fluid deficit presentation in pediatric patients, and remember the fontanelles close at 18 months. So if the child had been under 18 months, then the first answer would have been correct. But because they're older than 18 months, we can't assess fontanelles anymore. Question number 3. An older adult is admitted with dehydration. What signs and symptoms observed by the nurse confirm this diagnosis? Select all that apply. Is the answer number 1, tenting when assessing skin turgor? Number 2, complaints of thirst. Number 3, high blood pressure and tachycardia. Number 4, a blood pressure of 110/60 when lying and a blood pressure of 90/50 when standing. The answers here are number 2 and 4. Looking back at the question, it's asking for signs and symptoms of dehydration and how you would know that. So all the signs and symptoms we're thinking of: thirsty, confusion, dizziness, lightheadedness, weakness, fainting, which is syncope, maybe even a fall, dry mucous membranes, low blood pressure, high heart rate. Orthostatics, that's the lying to sitting change in blood pressure, and or decreased in concentrated urine. So with a select all that apply, we could pick any of those, and we're going to do the true-false method. Number 1 is false because you need to remember that skin turgor is not accurate in an older adult. Pay attention to who your patient is, right? Number 2, true. Number 3, the tachycardia part of that is true, but remember you can't pick an answer that's part false. And the client's blood pressure would not be high, it would be low if they're dehydrated. Blood pressure is always connected to volume, low blood pressure, high volume, high blood pressure. And then number 4, this tests your ability to decide if she's orthostatic or not, and she is according to this. So number 4 was true. So if you need to review the signs and symptoms of dehydration, especially in this case it was an older adult, and the orthostatic changes, if you need to review that, are right here on the slide. From lying to standing, if there is a decrease in systolic of 20 and in diastolic of 10, then they are orthostatic. That's showing dehydration. It's a very easy, quick assessment a nurse can make to see if somebody's dehydrated. Just remember though, you have to have them standing for at least 2 minutes before checking that standing blood pressure for accuracy, because we all get a little lightheaded sometimes when we stand up, and we have to give the body a chance if it's going to compensate to have an accurate measurement. Question number 4. The nurse is caring for 4 patients admitted with fluid balance issues. Which patient should the nurse check on first? Would you check on number 1, a client with second-degree burns to 20% of his body? Number 2, an elderly patient complaining of dizziness and lightheadedness. Number 3, a client admitted with congestive heart failure, exacerbation, and fluid overload. Or number 4, a client with a pituitary tumor who's being treated for a symptom of inappropriate antidiuretic hormone, SIADH. And the answer here is number 2. As a nurse, the patient whose room I should go into is the one that is having the symptomatic change in condition. Number 1 has no change. It doesn't say anything about him being symptomatic. Who knows? Maybe it could say he has these burns and he's being discharged today. We don't know. But number 2 has a complaint. She has dizziness and lightheadedness. You need to go check her. And then numbers 3 and 4, again, it doesn't say that there's any signs and symptoms, and therefore there's no reason to go into those rooms right now. Therefore, number 2 is your answer. Make sure you really think about which patient needs you first. Is it the patient that just states what you got in report? Or is it the patient that's having changes in conditions and developing signs and symptoms? Question number 5. The nurse is taking care of a client with diabetes insipidus, or DI. The nurse knows the decrease of ADH hormone will cause the patient to present with. Select all that apply. Is the answer number 1, decreased weight, number 2, dry mucous membranes, number 3, low blood pressure, and or number 4, low sodium level? The answers here are number 1, 2, and 3. So let's break down the question. We know the client has diabetes insipidus. This is when they are not making the ADH hormone. And so you can remember ADH holds water. In this case, the client is losing their water. Another trick is to look at that word insipidus. If you can find that little sip in insipidus, why would somebody want to be sipping a lot? Maybe because they're thirsty and dehydrated. So that's how you can remember that. And then how will they present? The thoughts are that without ADH in the body, the patient is going to be urinating a lot, and therefore they'll lose a lot of their water and become dehydrated. Also need to remember the water sodium balance. If you lose water, then the blood becomes more concentrated and the serum sodium looks like it's hypernatremic. The question could have even pushed you into remembering that because sodium would be high, potassium would be low. So that's another place the answers could have gone that you need to remember. And then with the select all, if we true, false these answers, number 1, true, remember weight goes down in dehydration. 2, true, dry mucous membranes. 3, true, blood pressure drops when volume drops. But number 4 is false. If water drops, sodium goes up. So if you need to, go ahead and review that ADH hormone. ADH impacts water balance impacts sodium, and sodium impacts potassium. You could have gotten answers around all 3 of those. Hope you enjoyed this video on fluid volume deficit and critically thinking through some questions. If you want more content like this, subscribe to our channel, and you can always find us at sciencestrategies.com, and please don't forget to like our videos.